China's governmental response to COVID-19, the good, the bad, and the ugly. I'm Adrian, and this is the Watchlist series. Now, trial site news is objective. We do not take sides, and of course, we would criticize our own government if and when it is warranted. In fact, trial site news acknowledges that elements within our own government were caught relatively flat-footed as this pathogen arrived on our shores. Now, that being said, based on the evidence we are sharing today, it's possible that elements within the Chinese government took steps to hide this from the public. And when that happened, this virus started to spread throughout the world, unsuspecting of what it had in store. Now, Wenliang was a Chinese ophthalmologist who worked as a physician at Wuhan Central Hospital. He warned his colleagues back in December about a possible outbreak of an illness that resembled severe acute respiratory syndrome, otherwise known as SARS, which is now acknowledged as COVID-19. He then went on to become a whistleblower when his warnings were later shared publicly. Now, back on January 1st of this year, the Wuhan Police Security Bureau issued a legal summons to Dr. Wenliang, accusing him of spreading rumors. Now, 2 days later at a police station, Dr. Li signed a statement acknowledging his misdemeanor and promising not to commit further unlawful acts. Quote unquote. Now, while 7 other people were arrested on similar charges, and their fate is unknown. Now, as shown by a New York Times study based on cell data, on that day, 175,000 people left Wuhan. At that time, 21 countries had flights directly in to Wuhan. Now, it took 42 days before the National Supervisory Commission called for the Wuhan police to rescind the reprimand order, finding the law enforcement procedures to have been irregular. By then, however, Dr. Wenliang had already died. Now, back to January. In a report written later, Chinese authorities acknowledged that 2019 nCoV, or COVID-19, may have acquired the ability for efficient human transmission by the start of January. Now, on the same day, the COVID-19 genome was fully sequenced, but it took China a week to share this data. And by January 3rd, China's National Health Commission, the nation's top health authority, ordered institutions not to publish any information related to the unknown disease and ordered labs to transfer any samples they had to designated testing institutions or to destroy them. Now, about a month later, after the first cases in Wuhan, the U.S. was notified by China. While China was still denying human-to-human transmission, Ho-Pak Liang of the University of Hong Kong Center for Infection warned that the city should implement the strictest possible monitoring system for a mystery new viral pneumonia that has infected dozens of people on the mainland, as it is highly possible that the illness is spreading from humans to humans. And then on January 8th, Chinese authorities publicly identified the virus, but they continued to claim that there was no evidence that the new virus is readily spread by humans, which would make it particularly dangerous, and it has not been tied to any deaths. WHO then declared that preliminary identification of a novel virus in a short period of time is a notable achievement and demonstrates China's increased capacity to manage new outbreaks. They went on to say that they did not recommend any specific measures for travelers. WHO advised against the application of any travel or trade restrictions on China based on the information currently available, or so they said. That's right, WHO failed to see the dangers this disease posed to the public at large, while the illusion that this could be managed continued. Now, on January 12th, Dr. Wenliang was hospitalized for coughing and a fever after treating a coronavirus patient. Still, the Wuhan City Health Commission declared that there was no evidence that the virus can spread among humans, but Chinese doctors continued to find transmission among family members, contradicting the official statements from the City Health Commission. And on January 14th, authorities said that preliminary investigations conducted by the Chinese authorities had found no clear evidence of human-to-human transmissions of the novel coronavirus identified in Wuhan, China. Yet this was 5 to 6 weeks after the first human-to-human transmission in Wuhan. Then, on January 27th, DHS and the CDC announced entry screening for travelers from Wuhan at 3 U.S. airports, San Francisco, JFK, and Los Angeles. Then begins the first steps for a quarantine by Wuhan by the Chinese authorities. NR states that by this point, millions have already visited the city and left it during the Lunar New Year celebrations. Singapore and Vietnam report their first cases, and by now an unknown but significant number of Chinese citizens have traveled abroad as asymptomatic, oblivious carriers. January 26th. New cases are reported in Los Angeles, Orange County, and Arizona. The virus is now in several locations in the United States, and the odds of preventing an outbreak are dwindling to 0. So, turning to a slightly more pro-Beijing perspective, on March 17th, so recently, an article in Nature outlined some of the positive actions taken by China in the face of this disease. Key actions included the extreme lockdowns and regional quarantines. By January, movement in and out of Wuhan had stopped. Those affected included more than 60 million people. Flights and trains were suspended and roads were blocked. Next, many Chinese cities ordered residents to remain home, with about 760 million people so confined. Now, currently, new cases are almost 0, at least according to their official reports. And according to Michael Osterholm, he said that extreme limitations on population movement have been quite successful. And Michael Osterholm is an infectious disease scientist at the University of Minnesota. And in a February report, WHO congratulated China on a unique and unprecedented public health response that reversed the escalating cases. Nature notes that the crucial question is which interventions in China were the most important in driving down the spread of the virus, says Gabriel Liang, an infectious disease researcher at the University of Hong Kong. The countries now facing their first wave of infections need to know this, he says. Solid estimates were that if China did not stop the COVID-19 spread, it would have infected around 500 million people, or 40% of China's population. But the spread rate was, at least officially, cut sharply by the lockdowns and quarantines. Experts feel the one big flaw in China was simply their delay. Now, as noted by the National Review, the slowness of the Wuhan government may have been a key driver of the world crisis. One model simulation by Shengji and Tatum at the University of Southampton showed that a 1-week advance in virus control implementation might well have prevented 67% of China's COVID-19 cases, according to the University of Michigan researcher Howard Markle. And he said that the delay of China to act is probably responsible for the world event. Information can at times be heavily censored in China by multiple levels of government. Hence, it is extremely difficult to pinpoint the truth, both in precisely when they took measures and on actual cases. However, enough information was available by local and national government sources for a conclusion that some form of it appeared to occur. Moreover, this could still be ongoing based on local Chinese residents' reports that information shared by citizens about the pandemic is being censored by the Chinese government. All nations need to learn from this experience. A candid, data-driven, evidence-based, and collaborative environment, regardless of political ideology, must also embrace relatively free flows of information coupled with an appropriately planned, methodical, and timely pandemic response, so all people can be better off tomorrow. After all, the world knows few boundaries. Based on what we at Trial Site News knows about the story, we view Dr. Wenliang as a hero and applaud his bravery at attempting to get the word out. From Trial Site News, I'm Adrian, and this is the Watchlist series.